Good afternoon, everyone. This is Valerie Haskin, the Rural Regional Behavioral Health Coordinator. Thank you so much for joining us on this beautiful Friday afternoon at lunch. I know it's gorgeous outside here in Northern Nevada, so I hope that wherever you are coming from, it is also nice out. And I appreciate you sacrificing time to come to this webinar. So before we get going, let's just go ahead and start with some housekeeping. So this webinar is being recorded. We're working to make the recordings available on the All Regional Behavioral Health Policy Board's website, nvbh.org. It's my understanding that the recordings will also become available at our partner websites with at least with the Behavioral Health Association of Nevada and possibly with NPHA. As this is being recorded, please do keep your microphone on mute. And if somehow you do get off mute and it is not your turn to speak, I do reserve the right to mute you for the sake of the webinar and all the other attendees. While you're on here, go ahead and pop your name, title, and agency in the chat because we would love to see who we have here today. As we move forward, you may have questions. Please hold them for the end of the presentation. We will have time for Q&A there. And when you want to ask a question, go ahead and use the raise hand function, and I will call on people as they raise their hands and go from there. This is a collaborative project for the Nevada pre-legislative session behavioral health webinars. Our partners are the Nevada Public Health Association Policy and Advocacy Committee led by John Packham. Also, the Behavioral Health Association of Nevada, currently led by Steve Schell. And then, of course, my sister board. So all 5 of the regional behavioral health policy boards, we had the chairs and the RBHCs on this project in the planning, and it was just fantastic. The purpose of this webinar series is really to help you, the attendees, get a snapshot of the current status of behavioral health systems across the state. And when we say behavioral health, we have to remember that we are using the more umbrella term of mental health alone, substance use and misuse alone, those two co-occurring, and those coexisting with other physical ailments. It's hoped that by attending these webinars, you will be better prepared to engage in the legislative session or keep track of what's going on, knowing what is already in play moving forward. We really have made efforts to include the best subject matter experts we could access. And we also want to make sure that our subject matter experts were those who would not benefit personally, professionally, or politically or financially from participating here. So we really appreciate everyone who came to speak with us. We do have some webinars upcoming, the ones that we have scheduled. Next Wednesday, the 22nd at noon, we have Behavioral Health Workforce Development, Nevada's Behavioral Health Workforce Data Review. That will be done by Dr. John Packham. He'll be going over the latest statistics on different types of providers, where the shortage areas are, how bad those shortages are, and as well as talk about the release of the 2025 Rural and Frontier Health Data Book. On Monday, the 27th at noon is Advocacy 101. So how to engage in the legislative process, regardless of your funding stream, whether you're an advocate, a professional, a member of the public who's just interested. This will really kind of help give some guidance as far as what the laws are regarding lobbying and how to make sure that you're not crossing that line. We can provide education, but we cannot lobby. So then the last one we currently have scheduled and open for registration is Friday, the 31st at noon. This will also be presented by Elise Monroy Marsala, who's doing the Advocacy 101. And she's going to be discussing how to read, understand, and use state budgets for your advocacy work. I have several other webinars in the works right now. We're trying to get them as many done before the start of the legislative session as possible. However, it looks like we're probably going to be trickling into the first couple weeks of the session, but we will be keeping that noon time for everybody's convenience. So these other sessions and topics that we're looking at include overview of the crisis response system, what's going on, what used to happen, how we've progressed, what the plans are for the future, what are crisis stabilization centers. We want to talk about mobile crisis teams. There's several different formats and funding streams that address mobile crisis in the state. We also want to talk about youth behavioral health, more workforce development, engaging with legislators, and of course, the Regional Behavioral Health Policy Board bills and the policy perspectives. A little bit about the boards. There's currently 5 regions. The boards consist of 7 to 13 members. That 7 is the minimum, and we can go up to 13. We represent local and professional perspectives. So the membership of these boards really is broad. We have law enforcement, EMS, providers, hospitals, etc. And really those perspectives of both their professions as well as where they're located, because we do give precedent or preference to persons who live within the regions we serve, really help advise state level agencies and commissions as far as what the impacts are of different policies and programs in the areas that are served by these boards. Each board gets one BDR each legislative session, and they're completely volunteer. Each board is illustrated here with the different areas. So in pink, we have the Washoe board. The rural board, which is the one that I serve, is geographically the largest, but we only have about 100,000 people. And then the northern board is that they're in yellow, southern in green, and Clark in orange. Each board does have a coordinator. I am the coordinator for the Rural Behavioral Health Policy Board. We're the unofficial staff of the board, and we really work as a state to local liaison to make sure the state knows what local communities need and want. We make sure that local communities know what the state has available and how they can collaborate together, and really advocating for the needs of both. We are funded by the Division of Public and Behavioral Health, Bureau of Behavioral Health, Wellness, and Prevention through the CDC's OD2A grant as well as the Mental Health Block Grant. Here's the current coordinators. My friend Dorothy is the coordinator for Washoe County, or for the Washoe Board. Sherilyn is the coordinator for the Northern Board. Mark Funkhauser is the coordinator for the Southern Board. And the Clark Board, the Clark position is currently vacant. And with that, I'm going to go ahead and stop my presentation and open up the floor to Stephanie, who is our speaker today.
Good afternoon, everybody. Welcome to my third and final presentation on substance use initiatives in Nevada. I will be sharing my screen here. Let's see. Okay, so we will be talking, let me get the right one up. Okay. So about DPBH, the Division of Public and Behavioral Health, our mission is to protect, promote, and improve the physical and behavioral health and safety of all people in Nevada, equitably and regardless of circumstances, so they can live their safest, longest, healthiest, and happiest lives. Our vision is a Nevada where preventable health and safety issues no longer impact the opportunity for all people to live life in the best possible health. And our purpose is to make everyone's life healthier, happier, longer, and safer. Our agenda today, I don't expect this presentation to take so long. On Monday, I covered some federal funding sources and supports we have in place to cover substance use initiatives. On Wednesday, we reviewed kind of this from the state level, our funding sources for substance use prevention, treatment, and recovery services. And today I'm going to go over some data sources that are relevant to this work and are out there for access to these topics, and then some hot topics to talk about, and then concluding with just a wrap up of these items. An introduction to the Bureau of Behavioral Health, Wellness, and Prevention. We are located within the Division of Public and Behavioral Health. Listed here are some programs within our Bureau. Not a list of all of them, but really identifying the community mental health services, which has authority through some of NRS 433 and NAC 433. Our substance use prevention, treatment, and recovery services, as outlined in NRS and NAC 458, which also includes certification of our programs. We have the Office of Suicide Prevention, as outlined in NRS 439 and NAC 439, and Crisis Support Services, as outlined in some of NRS 433 and NAC 433. Listed here is the bureau chief and I, Shannon Bennett. So some of our, like too much. Some of our data sources. So I wanted to talk today about what resources are out there that we currently utilize within our bureau and kind of other places. I know there's various entities throughout the state that use these data sources to kind of guide their programs. So we're going to talk through a little bit of the YRBS, which is the Youth Risk Behavioral Survey. We're going to look at some dose data and suitors data, as well as I will be showing you where our Office of Analytics dashboards are located that has a lot of this information in there. So starting off with our youth risk behavioral health survey, as I mentioned, if you were on Wednesday's call, a lot of our programming here within the Bureau, there's a big focus on going upstream and really getting to our youth and other populations with education, and not just education, but a lot of supports to help our youth and adolescents really have to see a path forward and work towards a healthy path forward in their lives. This data is, it's a survey that's done to middle and high schoolers, and it monitors health risk behaviors among youth and young adults. The data is used to track trends in youth behavior over time, identify high-risk populations for targeted interventions in various works within our state, support policymaking and funding decisions, and to guide the design and evaluation of school and community programs. I took a few pieces of the Youth Risk Behavioral Health Survey. If you look, I linked all this in this presentation too, so the links will work for you to get directly to this information. So we're going to go through just kind of some high level touch points on our youth risk behavior surveys that are given to our middle and high schoolers, and how we look at this information and how we utilize it to then implement projects within our state. So one of the sections of this survey, this slide here is looking at middle school, a comparison between 2021 and 2023. These surveys are done every 2 years. Looking at this section, which is emotional health, we do look at, in some of our grant funds and others, we look at not just substance use, but how all of these other things relate to substance use, or suicide ideation or any of that. So we're looking at really the kids as a whole and the various aspects, and this survey is one that helps us do that. So a couple things to point out here. The first column is 2021. Second column is 2022. So things that we look at in this kind of report is perhaps the first one, percentage of middle school students who felt sad or hopeless almost every day for 2 or more weeks in a row during the last 12 months. And kind of looking at the trends within the years. If we look more at the percentage of middle school kids who tried to kill themselves during the last 12 months before the survey, and how that kind of trends over time, and then comparing this to other data sets that we'll look at in future slides relating to this survey. So we take this information and look at the trends and really ensure that the work that we're doing at the prevention level is seeing a difference in these, and making sure that these trends are going down, or just paying attention to unintended consequences of other trends. So that was emotional health. This slide here is looking at electronic vapes. So as we see between the years, and this is still looking at middle school data, like the percentage of middle school students who ever used a vape product has increased over in that 2-year time frame. We also look at past 30-day use. And so the first question was more, have you ever done this? And then we really hone in on past 30-day use in collaboration with have you ever. So the third row down is percentage of middle school students who use electronic vape products during the last 30 days. So we also see that trend increasing. The second one down from the bottom is vaping marijuana. And so this, as we see in our middle school population, is continuing to increase. And so we pay attention to this. And then, like I said, compare this to the have you ever. We also take the middle school data and compare it to the high school data. As we know, people move from middle school to high school. And so really looking at the trends across that whole spectrum to ensure that we're making a difference in this space and that we're targeting interventions and programs and kind of family supports in this space. This also is a very good idea of why we need to go upstream on a lot of these approaches. I mean, on a lot of these topics to really support our adolescents in this space as we see these trends just going up. This slide here is looking at alcohol use also with middle schoolers and just seeing that, you know, between the years and these are still during, you know, the tail end of the COVID pandemic, but seeing these numbers increase in our middle school kids is what really drives us to implement our programs in this space. This last one, regarding the middle school data, I focus a lot on the middle school data because it's really the best upstream approach to some of this data as we look at these surveys. Really trying to follow kids and implement programming in the middle school arena, and then seeing that follow through all the way to high school. We're seeing an increase on non-medical prescription pain medicine use. A lot of this is opioids or others. So really looking at this data and seeing that our middle schoolers are continuing to seek out these pain medications without a doctor's prescription. Next, we'll kind of turn over into our overdose data highlights. The first I want to touch on, and this is a link here, so when you receive the data slides, you can click on the link here and it'll route you directly there. Our dose data is drug overdose surveillance and epidemiology. This data comes directly from the emergency rooms. So it's reported to the state directly, and so we look at these trends over time. This is monthly data that we receive, so it's one of our most reliable data and up-to-date data because it comes to us monthly, really looking at suspected drug overdoses in our emergency rooms. So the latest data we have is from November of 2024. We see that our suspected drug overdose rates have decreased, which is very good. And then also in November, our opioid prescription rates, and these are prescribed prescription rates, has decreased by 12% between the October and November timeframe. So we also track at our bureau and other levels of agencies track prescription rates and how many prescription opioids are being prescribed in our state. Also within the dose data is adolescent data as it relates to the emergency rooms. So we saw in November an increase of 48% of our adolescents seeking treatment in an emergency department for a suspected drug overdoses, mostly females, white, non-Hispanics. The top right figure, so figure 3, shows the various years of adolescence since 2018. So we've got some pre-COVID data in there, and you can see, you know, the top line is all the drugs, and we can see, yeah. We can see that pre-COVID, you know, the numbers were high, but they've gotten worse since then. They have dropped in the last year, between November 2023 and November 2024. But we continuously look at this to make sure that we are implementing programs within our state and really providing supports to address these concerns. Figure 8 on the bottom shows the monthly counts of suspected drug overdose emergency department visits for adolescents in Nevada. And this is monthly. So this is the last 12 months, the rates, the monthly counts in our state. So as you can see, there was a big spike in May. We pay attention to this. Sometimes this is, there are certain months that are higher. But we see, you know, it's dipped down from May 2024, but still an alarming amount of our kids in the emergency departments. For all these purposes, the adolescents that I'm speaking about are between the ages of 12 and 17. On the flip side, SOTA's data, which is mortality data that comes to us directly from the medical examiner's office. This is the state unintentional drug overdose reporting system. We utilize this in various settings as well to really look at overdose deaths in our state. In 2022, the state had 836 overdose deaths in Nevada. This data is a little behind as it relates to the medical examiner's data because it takes time to go through all these when somebody dies, and so this data is a little slower than the dose data that we just went over. In 2022, 68% of those overdoses were with individuals that had evidence of previous substance use. So we know that, really putting in efforts and supports to those that have a substance use disorder is important to us to really ensure that we're, getting to folks where they are and when they need assistance for, treatment, recovery support services, all those things. 44% of those overdoses had bystanders present, but only 20% of the 44% were administered naloxone. And so we utilize this data to really push efforts in our community for saturation of naloxone. If we know that there's for 44% of those overdoses, somebody's there, but only 20% of them had, the life-saving medication that could have saved this person's life. Just kind of ensures that we support our saturation plan and really get this life-saving medication to those in our community. Stimulants still contribute to the highest percentage of deaths in our state, with 67% of those overdoses having any stimulant involvement. And then of those overdoses, 64% had at least one missed opportunity for linkage to care for implementation of life-saving naloxone. And of those, Washoe County currently has the highest rates in our state. So with all that, I listed here some data sources. There's a plethora of data sources that we utilize. There's many federal surveys that are done that we utilize in our programming to look at substance use across the nation and in our state. They all have their own limited capabilities. But I listed here our Office of Analytics, that's within our director's office, puts together various dashboards for various topics. And so I linked here the substance use surveillance dashboard that really looks at substance use dependence, poisoning, and deaths in our state. We also work with the Office of Analytics to publish a epidemiologic profile every 2 years, I believe. And so that's the latest we have is the 2023. That's linked in there, really looking at all of these factors as we throughout the state as it relates to substance use programming. The SOTA's data that we just reviewed that comes to us from the medical examiner's office is linked here. There's also a substance use and criminality in Nevada report that was recently published through our Office of Analytics, really looking at the link to criminality as it relates to substance use in our state. And then the first data set that we looked at today was the YRBS data, which is administered through UNR, and that information is linked in here. A couple hot topics before we close it up that I put in here, just from my perspective and the work that we do within the Bureau, is really looking at upstream approaches with our adolescents. And it's not just strictly education, but it's also involvement in community events. It's family supports. It's all the things that we need to do to support our kids and really get them to, to think about the future, to plan for the future, and to understand the risks of all of this if as you're future planning and what the consequences of all these things may be in when you're sitting down to future plan. Understanding that fentanyl's out there, fentanyl's in a lot of our stuff. And that we also have xylazine and ketamine that's, kind of nationwide. It has its pockets of where it's been seen, not too much in our state, but always looking at this kind of stuff and looking at emerging trends as it relates to substance use in the nation, because it kind of has a pattern on how it makes its way around the United States. So really looking at those things and being aware. Building out our peer recovery services in our state has been a big focus of ours here within the Bureau, and I know in other agencies and programs as well. Really understanding that our peers are the ones with the boots on the ground, really, those with lived and living experience are important to the work that we do. And so really trying to build out those workforces, those services, what we can fund and help build infrastructure around in the peer space is really important to us. And then, of course, co-occurring treatment, we know these things aren't just in silos of substance use versus mental health. We do continue to understand that these are co-occurring things that occur. And so really trying to braid our funding, trying to braid our programs and seeing, taking a holistic approach to how we see these things in our state. And really being able to implement programs that can take the holistic approach to person-centered treatment and support services. So that is all. So in conclusion, our Bureau continues to increase capacity around data collection within all of our programs. As we continuously build out programs, then we're also building out the data that comes along with that. And so it's always kind of been a hot topic of ours. We are building out just ways we can capture this data in other ways, other avenues, other systems that we can look at analyzing all this stuff and putting it together for a better picture of what's happening in our state. We are utilizing all various data sources and needs assessment in our state to create a strategic plan for what our upcoming priorities will be. Just talking here within our Bureau and the Division of Public and Behavioral Health, understanding that there's, with emerging trends happening across the nation, like we've got to be like ready and posed to support our programs, to support the needs of our Nevadans and our state with all of these initiatives. We have spent a lot of focus on building out recovery support services, including strengthening the peer recovery workforce that I talked about, and then piloting programs such as recovery housing. And lastly, collaborating with other substance use programs within the state to align programs with best practices to truly move the dial and making a difference in this space. So in closing, every effort we make today builds a stronger, healthier tomorrow for individuals, families, and communities. And we know that, and we see that in our programs and all the initiatives that are being funded. So with that, that's the presentation for today. And here is my contact information if you have any questions that you don't want to bring up right now.
Thank you so much, Stephanie. So if you do have a question, please use the raise hand function. I believe it is either at the bottom or the top of your screen, depending on how it's set up. It seems to move around on mine. Do we have any questions for Stephanie? Okay, well, while you guys are thinking about it, I do want to let you know that I have posted the slide deck from today in the chat, so you can access that there. I will also try to get those posted on nvbh.org by the end of the day. I have a couple questions for Stephanie, if nobody's else is going to ask any. So when we talk about innovation, I think I work in obviously rural and frontier communities, and there's so much great research that's being done in other states in the more urbanized communities, and that's where a lot of our best practices come from. I think that one of our strengths in Nevada is that we have such a variety of communities. So I'm wondering, when we're talking about innovation, are there opportunities to do or to pilot new programs or ideas, particularly so long as they're being evaluated and monitored and that sort of thing? What are your thoughts on that?
Yeah, thanks, Valerie, for the question. So we do, and we understand, and obviously, I've been born and raised here, and so I understand Nevada and how it's different from other states, and every state's really different. But really, we have the ability to take our funds and find gaps based on what the data is telling us, what the people are telling us, and really talking to others in our communities to figure out what's needed and how we can get there. We utilize and do a lot of pilots, yes, to say let's study this to see if this approach is gonna work in Lovelock before we say we're gonna fund it, or just testing out how it will look in a rural community to do these sorts of things. So we do that a lot to see how it's going to work in various settings or various counties because we know the differences. A lot of times transportation is just the issue, and so really figuring out how a program like this would work in a small rural community is what we like to do, so we can study it and making sure we're meeting the people where they're at with the programs they need that makes sense for the community.
All right, thank you. So I just noticed that there were some questions that were put in the Q&A chat. Talking about the different data that you reviewed, can the data be separated into specific counties?
Yes. And I didn't show the separated counties data, but yes, if you click on both the dose and the suitors and the kids surveys can all be broken out by counties. And on the dashboards that I referenced, sometimes the county data, if it's too small, they can't report on it at the county level. In those cases, they try to report it out with the region level. So it's not, so it can be reported out because if it's too small, it's unable to be reported out. So yes, check out those links in the slide deck, and let me know if you're looking for very specific information. I can see if I can help you.
Awesome, thank you. And then from Joe Engel, we have with the recovery housing initiatives, is there any timeline on when it will be implemented?
Yes, we've got a pilot going right now that it'll start next month. Certification is on its way to being opened up in our system. So for those that are familiar with our certification for substance use programs, in our A-list system that will be released probably within the next month. They're working out all the details within that. So that is coming shortly.
Awesome. All right, and last one I have so far in the Q&A, from Marcy B. Have you looked into going further upstream for intervention? I'm the mother of 5 sons, and in my mind, junior high is too late for most of our kiddos. I'd like to see teaching emotional regulation in elementary settings. Is that something being considered?
I can't speak for like in the schools. A lot of our prevention coalitions that we fund do touch this based on kind of family supports, right? So we know that we see the spikes happening in junior high, and so we know, like, going upstream to those in elementary schools is really taking a more family approach. And so some interventions and prevention activities are happening in that space. So they are innovatively looking at where can we go to find families to talk about these things. Not necessarily inside the school setting, which I'm sure the schools have their own, criteria to do some of this emotional health stuff, but really trying to focus in on the family collaboration in this space to go further upstream.
Absolutely. Thank you, Stephanie. And I think just to add on to that, from the work that I've seen done, while that does come down to the schools, a lot of school districts have chosen to be very careful about any sort of social emotional learning, because it has been highly politicized. And a lot of times folks have the tendency to confuse social emotional learning with other strategies like critical race theory that may have roots in social emotional learning, but are not necessarily the same thing. They're kind of wrapped together. So it becomes kind of a political hot potato, unfortunately. So for those of you who are parents, I would highly recommend maybe attending some of your school board meetings, and seeing what's going on in your school district, because that is probably one of the best ways that we can advocate for our young ones. All right, I am not seeing any more questions in the Q&A box. Does anybody have any questions that they would like to ask live? Please use the raise hand function. All right, fantastic. Well, thank you all so much. Again, please go ahead and grab the PDF of the slide deck if you'd like to, or you can head on over to nvbh.org later on today, or maybe even next week if you would like to get the slide deck there. If you have any questions, please feel free to email me. You should have received an email from me earlier today with the login information, just in case it didn't come out otherwise. So we really appreciate your time and effort, and I think that's all we have for today. Thank you.
Thank you, everyone. Have a good day.